Good morning, Lindsay. How are you?
Good morning. Good. How are you?
Wonderful.
Good.
Is there anything that you have, one good thing to share that's personal or professional?
I do actually. We were able to discontinue 2 Foley catheters and 1 central line this morning.
Awesome. And any safety or quality issues to share?
Yes. So we did unfortunately have a patient in one of our rooms fall. We completed a fall huddle. We're also doing a unit-wide debrief this afternoon.
Okay, great. You'll let us know what you come up with that?
Yes.
Okay. So let's talk about your long-term Kata challenge and what organizational aim does it align to?
Sure. So our long-term challenge is to reduce the amount of CLABSIs on 4 East by 50%. Our goal technically right now would be 1. That aligns with one of our quadruple aims of improving healthcare. So the one that we're zeroing in on is the incidence of IHI-defined harm. That one, of course, specifically targets CLABSIs.
Okay, so what is your current condition?
So our current condition is, technically we had 2 CLABSIs for fiscal year 2020. We had 1 in September and then 1 in June. As of July, we do not have any. Our RNs are identifying which patients need CHG baths and discussing those needs with their CNA.
And your target condition?
So target condition is for us to sustain 80% and above of required CHG baths. For the clinical manager to complete daily audits of CHG baths 100% of the time, and then every patient needs to be put on a CHG bath schedule. We focused in on that area of opportunity because we noticed in tracking this as of June 24th, we actually had a drop to 50% of CHG bath completion on July 1st.
Okay. Okay. And your last step?
So our last step was for the CNAs to utilize their new bath sheet to indicate which patients needed CHG baths.
Okay, what did you learn from that?
We learned that unfortunately staffing is a challenge for us. So July 1st, when we dropped to 50%, we had 1 CNA on for that night, which was the major obstacle. It also brought up gaps in communication and then an error with the bathing sheet.
Okay, and your next step?
Our next step is for the clinical manager to designate which shift is responsible for CHG baths based off of the daily audits that are completed.
Okay, and what do you hope to learn?
So we're hoping to learn, 1, where our biggest gaps are, and 2, are the CHG baths completely preventing our CLABSIs, or is there another issue with our practice that we need to work on?
Okay, fantastic. Is there anything else that we can do for you, or you'd like to know, like us to know before we leave?
I don't think so. I think we're good to go.
Okay, great.
Thank you.
Thank you.